Do you frequently feel like your heart is racing, even when you're just sitting? Or maybe you get dizzy when standing up quickly. What if I told you these signs, fatigue, dizziness, even nosebleeds, could point to something rare happening in your blood? Meet Waldenstrom Macroglobulinemia, say Waldenstrom Macroglobulinemia. It's not common, but it's serious. Imagine your bone marrow, the factory inside your bones that makes blood cells, suddenly starts producing a flood of abnormal white blood cells. These faulty cells make a thick protein called macroglobulin, which can clog your blood like sludge in a pipe. That's why symptoms like blurred vision, confusion, or even bleeding gums might pop up. It's sneaky and slow, often showing up in older adults, but knowing the signs early helps you act faster. So what causes this confusion in your blood? Think of DNA as your body's instruction manual. In Waldenstrom Macroglobulinemia, a tiny typo, a mutation happens in a gene called MYD88. Over 90% of people with this disease have the same typo. It's like a software bug in a cell system that tells it, keep multiplying, don't stop. These rogue cells, called lymphoplasmacytic cells, build up in the bone marrow and spill into the blood. We don't know exactly what triggers this glitch. It's not from germs, and you can't catch it like a cold. It's not caused by diet or lifestyle either. But sometimes it runs in families, suggesting your genes might load the gun, though something else still unknown pulls the trigger. Now let's play detective. Have you noticed your bruises forming for no reason? Or do your hands and feet often feel numb, like they're asleep? These could be clues. Because the thick blood from excess proteins can't flow smoothly, it affects different parts of your body. For example, if blood moves slowly to your brain, you might feel confused or dizzy, like your brain is running on low battery. If the spleen gets swollen from fighting these cells, you might feel full quickly when eating, as if you're eating a whole pizza but stop at one slice. Some people even notice dark spots on their skin or bleeding from gums when brushing teeth. Others feel constantly tired, not just from busy days, but a deep, heavy exhaustion that sleep won't fix. These aren't normal signs, and if they stick around, it's time to ask, could something deeper be going on? First, they will ask about your symptoms and do blood tests. A key test checks for IgM, that is the thick protein clogging the blood. High levels, red flag. They may also do a bone marrow biopsy. Don't worry, it's not as scary as it sounds. Using numbing medicine, the doctor takes a tiny sample from your hip bone to check for those abnormal cells under a microscope. Another test called serum viscosity checks how thick your blood is, like testing if oil or water flows faster. Treatment, not everyone needs it right away. If you are feeling okay, doctors might watch and wait. But if symptoms grow, treatments like chemotherapy-targeted drugs like ibrutinib, which blocks the faulty signal in cancer cells, or even plasmapheresis, a blood filtering treatment that removes the thick protein, can help. It is like unclogging a pipe, so water flows smoothly again. Right now, there's no surefire way to prevent Waldenstrom macroglobulinemia. Remember, it's not caused by poor diet, smoking, or stress. But you can still take charge. Regular checkups, especially if you're over 60 or have a family history of blood disorders, help catch changes early. Think of it like servicing your car. You wouldn't wait for it to break down before checking the oil, right? If you notice odd symptoms, ongoing fatigue, unexplained bruising, or dizziness, speak up. Early detection isn't prevention, but it's the next best thing. Living healthy, eating balanced meals, staying active, avoiding unnecessary chemicals supports your immune system, even if it won't stop this disease directly. Scientists aren't giving up. Recent advances are like upgrades in a video game. New drugs called BTK inhibitors, ibrutinib, zanubrutinib, target the broken on switch in cancer cells more precisely, with fewer side effects than old chemo. Some patients now get these as pills at home, instead of long hospital visits. Researchers are also testing combination therapies. using 2 or more smart drugs together to hit the cancer harder. There's even hope in immunotherapy, treatments that train your own immune cells to hunt down and destroy the bad ones. Clinical trials are ongoing, and some patients are living longer, healthier lives than ever. Imagine a future where this disease is managed like diabetes, a condition you live with, not one that controls you. That's the goal, and we're getting closer.